Xander Holt here, the primal sex expert. And today I'm going to talk about Peyronie's disease treatment devices to fix a curved penis. But should you? A hunt for Captain Hook. In this video, I'm going to talk about the difference between a congenital curved penis and Peyronie's disease. Then I'm going to go into treatment devices that have been scientifically shown to actually work and straighten a curved penis. And then, as an added bonus, I'm going to go into the story of the eternal hunt for Captain Hook, which will really put into perspective whether or not you want to straighten that curved penis that you have, like I have too. Now, let's talk about, first of all, the congenital curved penis. That's the one you're born with or either you develop at adolescence. Okay, it doesn't come from an injury. And they'll curve, either to the right, like mine, or to the left, or down, or up, something like that. And these are typically not a problem unless you have pain with it, or it causes you psychological or emotional pain. You feel bad about it, feel inadequate about it, feel weird about it. I certainly did for a long time. We'll talk about that in a moment. Now, Peyronie's disease is a little different. That comes from typically an injury, or sometimes it comes from overdoing ED drugs. Well, a lot of it can come from breaking a penis. Actually, can break a penis. Like when a penis is not hard enough, like it's 80% hard, and you penetrate and you're going at it and you end up breaking that thing, it develops scar tissue or fat fibrous plaque, and that is not flexible tissue. So once that develops, that part of the penis can't expand, and it causes a curve in the penis. Now that's something you want to get fixed, particularly if it's painful. You shouldn't be dealing with that. So let's talk about treatment devices that actually work. First of all, there's the traction device. Now these have been shown to work, but the problem with these, in my opinion, is that they take a long time. They take a long time, and they're a hassle. You got to tape your penis up before you put them on. And then most of them, you got to wear 3 to 8 hours a day. That's a big commitment. And a lot of them, it take up to 6 months before you start seeing good results. If you're going to use a penis attraction device, I recommend using the Restore X. PubMed did a study on this, and it's the only traction device I know of that will actually work, but that has scientific research that shows it'll work, just using it 60 to 90 minutes a day. Okay, it's still a long time, but much better than 3 to 8 hours. And you can see results within 3 months. So that's an option, but not my preferred option. I greatly prefer list treatment. I think that's the best way to go, and I'm going to demonstrate this with the Phoenix, which is the first home list unit that actually works. Puts out virtually the same energy signature as a Gainswave unit. Now, the reason this is so great is that several reasons. First of all, the treatment is much shorter. It's like 20 minutes to get it done versus 60 up to 8 hours, 60 minutes to 8 hours a day. But also, 40 to 60% of guys that have Peyronie's disease also have erectile dysfunction. And this bad boy is really great at addressing erectile dysfunction because it increases blood flow by breaking up microplaque, including that plaque that's causing the bend in your penis, and it creates new blood vessels, which makes a stronger, harder erection. And remember, Peyronie's disease can happen because the erection wasn't hard enough in the first place, and you end up bending it or breaking it. This helps increase the hardness. Now, I have a bunch of videos, several videos on the Phoenix and how to use it. You can look at those if you'd like. But the difference is if you're using a Phoenix, and say you have a curved penis bent off to the right, like mine, instead of doing this top line, as you would normally do with a Phoenix, you skip that. In whatever direction your penis bends, you get that curve instead. Okay, you get that curve like that. And that will really help to straighten out your penis as well as penile pain. If you're having pain with Peyronie's disease, list treatment is particularly good with that. And if you buy the Phoenix through our affiliate link, we include the Spirit of the Phoenix for free, which helps you get rock hard regardless of the situation you're in. So extra bonus there. Now, and there's good research behind list treatment in terms of Peyronie's disease. Now, in addition to that are pumps. Now, I like to use the pump in addition to the list treatment. That's what is the most effective if you use them together. But pumps in and of themselves will also help with Peyronie's disease, even if you don't use it with the list treatment. Now, what I really like to use is the Kaplan pump, because the Kaplan pump comes with two different cylinders. Okay, it comes with a small cylinder and a large cylinder. The large cylinder gets the buried shaft of the penis. And that's really helpful because it stretches it out and actually helps with penile length in addition to decreasing the curvature of your penis. But the smaller one also helps with that, as well as the girth of your penis. And it comes with a great, gauge, so you don't hurt yourself. If you use an air pump, you absolutely must use a pump with a gauge, because you can really hurt your penis if you don't do it right. This should not, if you're flaccid, shouldn't go above 5 inches of mercury, and if you're hard, it shouldn't go above 7 inches of mercury. Okay, I'm going to release a separate video on the pumps so you get a better idea. But pumping works. There's research behind that as well for straightening out a penis. In addition to the Kaplan pump, which I highly recommend, there is water pumps that work really well too. Now, water pumps don't need a gauge because they don't have the vacuum issue that air pumps do. That's a nice feature. They're just a little bit more inconvenient because you got to be in the shower or the bathtub to use them. But that's an actual benefit in that you have all this warm water in there that loosens up the tissues so that it helps make those tissues easier to straighten out when you're straightening out your penis, right? So this is a Peniment. This is one of the ones I recommend. It works really well. But also there's what's called the Bathmate. Also, excellent one. But their Hydromax series in particular works great as a pump to help straighten out your penis. And pumps have good research behind them showing that they work. Okay, but should you straighten it out? Okay, I was going to do that because I, like probably a lot of you guys out there who have a curved penis, particularly if you were born with one and been dealing with it your entire life, have some psychological and emotional issues with it. Feeling weird, feeling not normal, all those different things. So I was going to straighten mine out, although I'm 52. I'm a little attached to it. Had a little bit of mixed feelings about that. But when I told the woman that I'm seeing right now that I've got a device that's going to help me straighten out the penis, I have never seen her text me back so fast. She's saying, hell no, don't do that. I love that curve. And then we went into all the reasons she liked it so much, and that's the fact that it hits all these areas. And then I have a client of mine I also told about this device, particularly the Phoenix I was talking about. And he was saying, I just got done dating a woman that says that she's always on the eternal quest for Captain Hook. And we had this text message conversation where she explained all this in the same way. It's like she's always looking for a guy who has a curved penis because it hits areas of her vagina that a straight penis just can't do, is how she puts it. So that's all she looks for, is guys with curved penises. And she says it doesn't matter the direction it's curved in, it feels great. So keep that in mind before you go straightening out your penis. Is the woman that you're with, does she really like it? She may really like it, and you guys haven't talked about it. And there are certainly lots of women out there that really do like it. I'm not saying all women do, but there's certainly some that are specifically looking for guys with a curved penis. So think about that before you straighten out yours. And also keep in mind, if you got Peyronie's disease, if it's really bent a lot, you don't have to straighten it all the way. You can also just straighten it some of the way. So you still get to keep some of that curve if you want. Even with a congenital curve, you don't have to straighten it all the way. Just straighten it some of the way. Okay, if you want to keep that advantage. I always see it as a disadvantage, but there's a big advantage for a lot of women to you having a curved penis. So keep that in mind. All right, that's it for this video. If you like this video, please like it below, subscribe to our channel, and because I got lots more great stuff coming up. I've got a brand new video coming up on these pumps. I'm going to go deep into the pumps and how you can use them to not only overcome erectile dysfunction and Peyronie's disease or a curved penis, but penis enlargement. All right, I will see you in the next video.